Diabetes is a chronic condition characterized by elevated blood sugar levels, which, if not managed properly, can lead to serious health complications. Type 1 diabetes, an autoimmune disease, typically manifests early in life where the immune system mistakenly attacks insulin producing cells in the pancreas, necessitating lifetime insulin therapy. In contrast, type 2 diabetes usually develops later and is characterized by the body's inability to use insulin effectively, often associated with lifestyle factors and managed through diet, exercise, medication, and sometimes insulin. Treatments for both types of diabetes focus on maintaining blood glucose levels within a normal range to prevent complications. Risk factors for type 1 diabetes include genetic predisposition and certain environmental triggers, while type 2 diabetes is more closely linked to factors like obesity, inactivity, and family history. Here's a detailed look into the nuances and complexities of both type 1 and type 2 diabetes. Onset of disease, juvenile versus adult. Type 1 diabetes typically manifests in childhood or adolescence, earning it the nickname juvenile diabetes. This autoimmune disorder results from the body's own immune system mistakenly attacking insulin-producing beta cells in the pancreas. Consequently, the pancreas produces very little or no insulin, necessitating lifelong insulin therapy. On the other hand, type 2 diabetes frequently develops in adulthood and is often associated with obesity, a sedentary lifestyle, and genetic factors. Unlike type 1, the body in type 2 diabetes produces insulin but cannot use it effectively, leading to insulin resistance. Management of type 2 diabetes often starts with lifestyle changes and oral medications, with insulin therapy as a later stage treatment. The distinction is crucial for accurate diagnosis, treatment, and management of the disease. Insulin dependence, absolute versus relative. Type 1 diabetes is characterized by the immune system mistakenly attacking and destroying insulin-producing beta cells in the pancreas, leading to an absolute insulin deficiency. Consequently, individuals with type 1 diabetes require lifelong insulin therapy to manage their blood glucose levels. On the other hand, type 2 diabetes stems from a combination of insulin resistance and relative insulin deficiency. The body's cells become less responsive to insulin, and while the pancreas still produces insulin, it may not be enough to overcome this resistance. Lifestyle modifications and oral medications are typically the first line of treatment for type 2 diabetes, with insulin therapy introduced as the disease progresses or in cases where other therapies fail to maintain blood glucose control. Immune system involvement, autoimmune destruction versus insulin resistance. In distinguishing between type 1 and type 2 diabetes, the role of the immune system is pivotal. Type 1 diabetes is characterized by an autoimmune response where the body's immune system mistakenly attacks the insulin-producing beta cells in the pancreas. This results in little to no insulin production, making patients dependent on exogenous insulin for survival. On the other hand, type 2 diabetes typically involves insulin resistance. In this case, the pancreas still produces insulin, but the body's cells become less responsive to it over time, largely due to genetic predisposition, lifestyle factors, and obesity. The nuanced understanding of these mechanisms is crucial for accurate diagnosis, treatment, and management of these distinct forms of diabetes. Role of obesity, less common versus strongly associated. Type 1 diabetes, primarily an autoimmune condition, is less often linked to obesity. In this form, the immune system mistakenly destroys insulin-producing cells in the pancreas, and the onset is largely independent of body weight. Contrastingly, type 2 diabetes is strongly associated with obesity. It results from the body's resistance to insulin combined with a relative insulin deficiency. Excessive body weight can lead to an increase in fatty acids and inflammation, culminating in insulin resistance, which is a hallmark of type 2. Therefore, managing weight through diet and exercise is a cornerstone of type 2 diabetes prevention and management, highlighting the significant role that obesity plays in its pathogenesis and progression. Endogenous insulin production, little to none versus variable decrease. Type 1 diabetes is characterized by the autoimmune destruction of insulin-producing beta cells in the pancreas, leading to a critical deficiency or complete lack of endogenous insulin. Onset can be rapid, often during childhood. Conversely, type 2 diabetes results from the body's inability to effectively use insulin due to insulin resistance and typically presents with a gradual decrease in insulin production. Notably, in some cases, individuals with type 2 can retain a degree of insulin function for years, which can vary greatly person to person, and initially may not require insulin therapy. This contrast in endogenous insulin production between the two types is a crucial factor that influences management strategies and impacts patient education on monitoring and treatment, including dietary control, medications, and the need for exogenous insulin administration.